Hello, my name is Jill Palmer. I'm a graduate from the 2013 MSc Mindfulness course. A bit late getting here because I was waylaid by an accident a couple of years ago, so it's nice to be here today. I chose to do a work-based project in my third year. My research title is Compassion in Healthcare, a comparative study of conceptualisations and approaches to cultivating compassion found in Western healthcare systems and Tibetan Buddhism. And breathe. Okay, so a bit of background about me as a researcher. It sounds a bit detailed, but it's important because I've got lots of connections to this subject. So I've worked in the NHS in England since 2010. My field's maternity care. My main role is birth educator. I develop and deliver, if your pardon the pun, courses for parents-to-be. I'm also a mindfulness teacher. I work with my Trust Director of Psychology to create and lead mindfulness courses for colleagues. And I've just piloted a Mindfulness for Parents-to-be course as well. I'm accredited to teach the Mindfulness Association's Mindfulness-based living course as well. Since 2013, I've been exploring Buddhism, predominantly Tibetan Buddhism. When asked, I do describe myself as a Buddhist. However, I'm not sure I really qualify as that yet. At the moment, I regard Buddhism more as a science of mind than a religion. Not sure where this is going to take me. An ancient, well-tested understanding of human psychology and well-being and a system of trainings. That's where it's sitting with me at the moment. Okay, so let's have a look at why investigate definitions and approaches to cultivating compassion. Well, that's because in 2013, compassion became a hot topic in healthcare, and that was the first year in my MSc. In 2013, Robert Francis did an inquiry into serious care failings in mid-Staffordshire NHS Trust hospitals in England, and this is failings that were occurring between 2005 and 2009. The inquiry started a nationwide debate about compassion in the NHS, and the report made 290, I'm going to say that number again, 290 recommendations for improvements. Governments, patients, families of parents, and professional bodies such as Royal Colleges began calling for a rekindling and a repositioning of compassion in the NHS and modern healthcare practice. So my work-based study was a response to the Francis Inquiry report and these calls for a culture of compassion. My intention and motivation were threefold: to prompt further discussion about compassion, to identify what the NHS could learn from other approaches, and to suggest potential lines of research and action. So today I'm going to give you a brief overview of what I discovered when I carried out this study. In terms of methodology, I used a narrative literature review underpinned by mindful inquiry. This was because there was already a wealth of materials on the topics under investigation, and the areas of interest were existing interpretations of concepts and practices. 121 sources were reviewed, and they were all from the last decade. Older sources were only included if they had something to add to the narrative. The exploration focused on the writings and views of healthcare and mindfulness practitioners rather than pure academic research. And that was because I was trying to capture the lived rather than the theoretical experience of compassion in healthcare. A representative sample of professional organisations within the NHS and thought leaders within healthcare was used to develop a picture of the conceptualisations of compassion. 12 voices were included in that sample, and the 2012 Compassion in Practice strategy developed by the Department of Health Chief Nurse Jane Cummings was taken as the accepted NHS approach to the cultivation of compassion. This was then compared with 3 other approaches developed by Western healthcare professionals. From the United States, we had the Compassion Cultivation Training Programme that was established by neurosurgeon Professor James Doty of Stanford University Medical School and developed by Thupten Jinpo, one of the Dalai Lama's translators. From New Zealand, I explored Hearts in Healthcare, a global online community for those wanting to rehumanise healthcare, founded by UK-trained, New Zealand-based anaesthetist Dr. Robin Youngson. And from the UK, I chose to explore mindful compassion, a synthesis of evolutionary psychology and Tibetan Buddhism developed by Paul Gilbert, who I think most of the audience will be really familiar with, that saves him a bit of time, and Choden, who you also know very well. Okay, and those 4 approaches were then compared with 2 Tibetan approaches, one from the Gelug school represented by the writings of the Dalai Lama, and one from the Kagyu school represented by the writings of Chodgyam Trungpa. So what did we find? The study revealed that there was a range of conceptualisations and definitions deployed within the NHS. 22 were reviewed and 19 themes emerged from those 22. And the Compassion in Practice strategy defines compassion as how care is given through relationships based on empathy, respect and dignity. It can be described as intelligent kindness and is central to how people perceive their care. The study also found that there is a lack of common inclusion of suffering in self and a lack of a commitment to prevent or alleviate suffering in self or others in most NHS conceptualisations of compassion. We put the patient first is a common mantra. The approach has been taken to creating a culture of compassion within the NHS reflect these disparate understandings and are very different from the other 3 Western approaches reviewed. The 3 other approaches reviewed conceptualise and define compassion in terms familiar to Buddhists. They acknowledge that compassion includes self-compassion and that self-compassion is a prerequisite to authentic and sustainable compassion for others. I put myself first so I can meet the needs of others is the expectation here. The methods they propose for cultivating compassion, like those found in Tibetan Buddhism, reflect a shared conceptualisation and definition and its underpinning psychology. Compassion is understood to be, as the Dalai Lama describes it, a sensitivity to the suffering of self and others with a deep commitment to try to relieve it. In terms of conclusions, there are quite a few. So this study concludes that the culture of the NHS has become dislocated from compassion. Within the NHS, there is debate about what compassion is. There is little evidence of a contemporary understanding of the psychology or the neuroscience underlying compassion. There is a debate about whether compassion is something that can be developed through training. The NHS has reached a position where compassion needs to be re-understood and reintegrated into training and practice. This position is summed up in one phrase contained in a Compassion in Practice document called Building and Strengthening Leadership. In describing what it takes to create a climate in which compassion thrives, the NHS stated, it requires stepping off the map. The Compassion in Practice strategy, although well-intentioned and effective in raising the profile of compassion and the commitment to reintegrate compassion into practice, appears to lack the insight, wisdom and experience available from the fields of mindfulness, evolutionary psychology, neuroscience, compassion and self-compassion. The implications of this are that the NHS is not likely to achieve cultural transformation at the depth, scale and pace required for a sustainable culture of compassion to emerge, take root and flourish. And the recommendation that came out of that, I've got a different page there, sorry, I thought it was on the slide. There's one recommendation that came out after reviewing the conclusions, and that was that the NHS explores an 8-fold path to creating a culture of compassionate care. That 8-fold path consists of a comprehensive, independent, multidisciplinary expert review of the Compassion in Practice strategy, its outcomes and its impacts. A broadening of the interdisciplinary evidence base used to inform strategies and initiatives. Transformation of internal training by trialling the use of Paul Gilbert's work on the compassionate mind as a standard explanation of compassion and trialling mindful compassion and its definition of compassion as a standard for internal training for all NHS employees. Transformation of external training by trialling the use of compassion cultivation training in universities supplying healthcare graduates to the NHS and trialling the study of Gilbert's work on the compassionate mind as the norm in clinical and allied health professions, education and training. Create a Sangha. Encourage all NHS employees to connect with Hearts in Healthcare and to use this global social network as a resource when working to transform healthcare. Then we come on to advocating for compassion by reframing the relationship between chaplaincy, organisational psychology, occupational health and workforce organisation and development to create a team that has stewardship for compassion in every NHS workplace. Then removing suffering in the workplace by trialling the use of the causes of suffering in the workplace identified by the Centre for Compassionate Organisations so that NHS organisations can self-assess and then commit to removing those causes of suffering. And finally, to reconnect with applied ethics and philosophy as a means of closing the current gap between corporate leadership rhetoric and expectations and the lived experience of NHS employees. And that eightfold path draws this presentation to a close. Thank you so much for your time and attention. I hope it felt like a worthwhile 10 minutes.